standing in one of the slums of Dhaka. Dhaka has a population of about 12 million people. About 4 million people are living in slum communities like this. This is Mirpur slum, one of the larger slum areas. The housing that you see behind me is typical for this area. People are building houses wherever they can. This is Jahanara, who's one of the beneficiaries of a Water1st funded project here. Because they're living in a slum and they don't have legal access to the public water system, they created this connection so that they could get water. But you can see that the location of it is in a pretty horrific environment. There are a lot of hanging latrines pretty close by. And they also have to pay for this water. So with the support of Water1st, they now have a legal connection to the Dhaka water system.
Our new water point is so close to our houses. We spend a lot less time collecting water now. We are also using more water. Before we were using water from the pipes just for drinking. Now we use the new water for drinking, for washing, and for bathing.
Slum dwellers need to have water like all of us, and their only option is to buy it from this illegal connection. They end up paying about 10 times what somebody with a legal water connection would pay for that very same water.
A group of 20 women, one adult from each household, worked together to make this map of our community. We drew the roads, houses, working water points, broken water points, places where we defecate, everything. The map helped us to identify 6 major problem areas we face. Then we voted to rank our problems. When we were finished voting, we found that water was our most important problem, followed by safe sanitation.
This trip to Dhaka, we've been really fortunate that we had 8 travelers come with us and see the work firsthand that's being done.
I was able to come with my son on a trip to Bangladesh to see the drinking water and sanitation projects. It's been an amazing trip. The songs, the poetry recitations, the dancing that we were greeted with were so generous. So much work had been put into them. I just felt honored to be part of that celebration.
Well, you expect poverty, but it's just something that you can't imagine unless you've seen it. Even if it's described in pictures and words, it just doesn't have the same impact. When you go there, the passageways are that narrow and you have to walk sometimes sideways. It's pretty shocking. When they get the wells, they just seem so happy.
With DSK, we're visiting the projects that they've implemented, the water points, the latrines, but we're also looking at some of the other work that they're doing. They're working on household level treatment, chlorinating water, which is an affordable way that poor people can make their water safe to drink.
Also in water points, E. coli index is very, very high. So you need to boil that water. But in slums and other places where poor people live, they don't have the ability to boil the water. So chlorine disinfects your water, drinking water. There's a project running here. So they'll go around and explain the importance of keeping clean water and how to use this type of sodium hypochlorite solution.
To use this solution, we put 6 drops into 15 liters of water. After 30 minutes, the water is safe to drink. People here are not aware of the danger of drinking contaminated water. It is my job to go into their houses and tell them about these things. I explain to them that their children will be healthier if they treat the water with chlorine.
We're visiting DSK's vacuum tug system. When DSK is helping our beneficiary communities to build septic systems and household latrines, their tanks need to be emptied. Households and communities are charged a fee to have their septic tanks pumped out, and then the contents are taken to the municipal treatment system. The fees that they charge the communities and the households are able to fund the salaries of a driver, a manager, and 2 operators, as well as pay for fuel and maintenance. So altogether, it's a totally self-sustained system.
Good afternoon, neighbors, and welcome to our first training session on safe water. I have some cards with pictures which will help us learn together. Over the next month, we'll learn many things about safe water, sanitation, and hygiene education. These lessons will help keep you and your children healthy. Today, we'll discuss how to store safe water for drinking and cooking. Please take a look at this picture of a water container being cleaned. It is very important that you clean your storage container every day with soap.
One thing I was impressed with DSK was the sense of community they created. First, they would map out the totality of the community that was going to be involved, and then representatives would come in for the community, and it just has set up a whole structure where they have a vehicle now to make change in their lives.
I think that they've all been really moved by not just the poverty that you see everywhere here, but the really good things that are happening in the slum communities as a result of funding from Water1st.